Good morning. Thank you all for joining us, and thank you to those tuning in via our various news outlets and social media. As concerns about the spread of the novel coronavirus COVID-19 have grown rapidly in recent days, the City of Norfolk and area public health officials, as well as our education and community partners, have remained in close contact and communication. On Friday afternoon, those standing here with me today, representing public health agencies, healthcare provider systems, schools, community centers, and public safety emergency service operators, had an extensive discussion about the threat of this virus and the importance of collective action to mitigate its spread and the impacts of its spread. We want to take the opportunity this morning to update you about those discussions and decisions that have been made in the interests of public safety. First, let's be clear. Currently, there are no confirmed cases of coronavirus in Norfolk or Madison County. Several individuals have undergone testing protocols, but none have yet to be found to have tested positive. However, statewide, 18 positives have been reported as of this morning, including one in Douglas County over the weekend, which is considered to be the first case of community spread in the state, meaning the individual was determined to have had symptoms of the virus prior to any recent travel. Given these facts, and having the benefit of seeing how quickly the virus has spread in other communities and regions to date, it was determined that careful, strategic, collective action should be taken to keep Norfolkans and Northeast Nebraskans safe. Let's also be clear about why precautionary actions are important and deemed necessary. Our health officials will expand upon this, but in a nutshell, this is a new viral strain of which no one has immunity. It spreads relatively quickly and indiscriminately. Precautions are meant to mitigate impact or flatten the curve, a phrase you've no doubt heard by now, to prevent a spike of sudden cases that can overwhelm our healthcare systems. The virus is most dangerous to our elderly populations and those with existing health conditions. The more we can slow the spread and limit exposure to these populations, and therefore keep our medical care providers from being inundated, the better outcomes for everyone. What we know is that smart and vigilant personal hygiene, social distancing, or limiting close exposure to others, and curtailing large gatherings of people can all work together to slow the spread of the virus and limit the severity of its impact, not only in Norfolk, but also throughout the surrounding region. With that in mind, the City of Norfolk is taking special action to play its part. Large community-sponsored events, such as the Mayor's Prayer Breakfast, which is held each year near Easter and draws hundreds of people throughout our community and area, is being postponed to a later date. We are also canceling, for now, programming at the City Library, as well as restricting building access. And we are taking special precautions through new practices to safeguard the health of our first responders and other essential front lines city personnel to ensure continuity of public services. Just over a year ago, I stood at this very podium and spoke to the community about the threat of unprecedented flooding. That was a trying time for all of us. But because of strategic planning and prudent action on the part of past leaders, the expertise of our public safety officers, the smart utilization and employment of available resources, and, very importantly, a strong sense of neighbor helping neighbor throughout the city, we pulled through a tragedy of historic proportions, largely unscathed. Today, this threat, one of a much different form and a more nebulous form, will require similar resolve, planning, and citizen and neighbor cooperation. I have no doubt we'll come through this with the same kind of mindfulness of being neighborly and looking out for those most vulnerable around us. How can you do this? Be proactive, smart, and vigilant about your health and your family's health. If you feel unwell, stay home. Practice good hygiene with aggressive cleanliness and hand washing, and limit your exposure and proximity to others. Do this not only for yourself, but for those around you who may very well be more susceptible to the worst of this disease. Also, keep this in mind. While we're now taking uncommon precautions, life does not need to stop. Many employees will be able to continue their work from home or their workplace, and many students will be able to continue their studies from home. In the meantime, our small businesses still need your support. As we are smart and careful as to how we move about and protect ourselves and others in the community, we can also continue to be active and creative in utilizing the services and buying the goods we need from our small businesses. With the team assembled, I am confident we are as well positioned here as anywhere to meet this unfamiliar challenge. And that is thanks to the expertise and commitment of our public health officials, healthcare providers, education leaders, community partners, and public safety team, all of whom are represented here and will be sharing with you updates from their respective fields. Before I introduce them, I want to point you to important sources of information you can use to stay informed of developments about coronavirus and community updates. First is the City of Norfolk website at www.norfolkne.gov. At our homepage, you will find links to sources of information from the Elkhorn-Logan Valley Public Health Department, the Centers for Disease Control and Prevention, and the World Health Organization. This information is also accessible in Spanish and other languages. Now, for further updates, I would like to call forward first Melanie Thompson, who is Director of the Elkhorn-Logan Valley Public Health Department.
I want to clarify that I'm the Emergency Response Coordinator at Elkhorn-Logan Valley Public Health Department. Our director is also busy in the eastern part of our district. We actually cover Madison, Stanton, Cumming, and Burt counties. And so, though this is our focus because it is our population center, she is busy on the other side of our health district today. So Elkhorn-Logan Valley Public Health Department's main goal in this situation is to help slow the spread of the coronavirus that causes COVID-19. We are needing to do this because we don't want to overwhelm our healthcare system. Hospitals and clinics have had a brutal influenza season, operating at near capacity for the whole season. People with COVID-19 symptoms will crowd and complicate this system even further. The second reason why we need to have the slow spread of COVID-19 is to protect the most vulnerable in our population. These are the elderly, those with compromised immune systems, or who have chronic heart and lung issues. It's important that those folks who are vulnerable to COVID-19 heed the warnings that are being talked about. We've seen how this has affected nations and people overseas. It's time to pay attention to the warnings that we are receiving. Everyone has a responsibility to help stop the spread of this disease. Stay home if you're sick. Avoid group gatherings if at all possible, and check on your neighbors. There is a myth that this is like the flu. This is not the flu. Flu has an annual fatality rate of between 0.1% and 1% generally. COVID-19 has a mortality rate so far of between 2% and 3.5%, and disproportionately affects those older and vulnerable populations. Don't get me wrong, most people will only get mild to moderate symptoms, and they won't even require a doctor's care. However, those vulnerable populations may have severe symptoms warranting medical care. The final message is this: we are a culture that is used to going to work or school when we are sick. That has to stop now. Stay home when you're sick. My hope is that this novel coronavirus acts like other coronaviruses and disappears with warmer weather. If that happens, it would buy us more time to prepare and to use up some of that toilet paper you've been hoarding. before the cold and flu season happens this next fall and winter, and to continue working on a vaccine that can help reduce the impact of COVID-19. This is a rapidly evolving situation. It's important for everyone to make sure that they're getting the updates that are occurring. Our health department posts regular updates about this situation on our Facebook page, which you can find at www.facebook.com/ELVPHD. We also just started an Instagram account yesterday, and we'll be posting information there. We will also be posting information on our Twitter accounts, in addition to media releases as warranted. And so I just want to thank you for the opportunity to be talking to you today. If you have any questions, please reach out to us. The Department of Health and Human Services also has an information number, which is posted on our website as well. Thank you.
Thank you, Melanie. We will have an opportunity for questions for all of us at the end, but I want to continue through the updates here now. Next, Kelly Driscoll, who is CEO of Faith Regional Health Services.
Good morning. At Faith Regional Health Services, we have increased our protocols and changed our protocols as we've had daily guidance from the Department of Health and Human Services, our local public health department, and the CDC. And we've been adopting those policies as they've evolved. One of the things that we were proactive on was the off-site testing that we announced last week. So we did create an off-site testing facility that keeps people that potentially would have COVID-19 off of our campus, which is important for our vulnerable population that we take care of. At this time, that is still by appointment only and is through a proper screening protocol that the CDC and Department of Health and Human Services guides us on. That may be changing, and as a matter of fact, we anticipate it will be changing. As of right now, if you screen positive, and that would mean you are displaying the symptoms of COVID-19, which is a cough, a fever, and shortness of breath, and you have traveled outside your area in the past 30 days, or you've had exposure to COVID-19, you would screen what we consider positive. At that time, there's some clinical judgment that goes into that. In the past, we would require an influenza or what they call a full viral panel that I'm told will be eliminated today. But we're following the guidelines as they come to us. If that was negative, then with prior approval, we could get the COVID-19 test through the state. One of the changes that was also implemented late last week was we could use commercial testing, which would bypass some of those other protocols of needing approval. And again, we're anticipating this will change as the regulations change today. We've also given test kits to our local healthcare providers. It's important that we keep people that believe they have those symptoms away from our healthcare emergency room and areas that would be at highest risk. Now, that's not to say if you don't have severe symptoms that we still want you, obviously, to call 911, and I'm going to leave Dr. Mensah to talk about what that means so that we can provide you with the emergency care that you would need, hence why we don't want people that don't display those symptoms clogging up that service. So again, as those testing protocols become available, we will continue to educate our local healthcare providers as Faith Regional and our public health department to get that communication out. What we do know is that one of the priorities that will also be placed on those testing is a priority to our first responders and healthcare providers. And the reason there's going to be a priority to those folks, as well as our elderly with high risk, other comorbidities to them, is because if our healthcare providers and our first responders get sick, then again, that's clogging the system and there's less people to take care of the real critical patients that will need that care. Nebraska Medicine put out last night, those of you that may have seen that, Dr. Linder, who's the CEO at University of Nebraska Medicine, put out some statistics that when one person gets infected, it affects 2.5 on average other people, and so on and so forth, and those 2.5 infect 2.5. If 100 people get infected, 5 of those right now are anticipated to needing hospital care. And over an 8-week period, that would be between 30,000 and 90,000 people. We don't have that many beds in Nebraska. So that's the reason for flattening the curve. We need to flatten the curve to elongate out the spread of the virus and not have that direct peak that people are experiencing in other areas. So we need your help with that. We as schools and the city and healthcare providers, and there's gonna be others that will be talking about that as well in public health, will do our responsibility and our part to keep you well. We need the public's help to do that as well. Follow the hand hygiene, perform the social distancing, cancel the large gatherings that you have, and help us help you maintain health and safety in our community. One of the things that we've also implemented is visitor restrictions on our long-term care as well as our hospital. We will continue to probably evaluate that and make that more strict. At this time, we're allowing 2 visitors into the hospital. If you're not displaying symptoms, anticipate we will be restricting access and checking people more thoroughly with that. Part of that has been to keep our population, our vulnerable population, from getting further ill, because we still take care of people that don't have the respiratory strokes, cardiac disease, cancer, and such. So we'll be continuing to evolve that, and more guidance will be coming, and so we will evolve with that as well and push that communication out to our other healthcare providers.
Thank you, Kelly. Next, Dr. Fua Menza, who is the Faith Regional Health Services infectious disease specialist.
Hi, good morning, everyone. I started working a couple of months ago, and I didn't know that COVID-19 was coming. But I guess we are all ready for COVID-19. So just a little bit about this virus. A lot of people will really not understand what it is. It's a coronavirus, and corona, just like the beer Corona, means a crown. So it has something like a crown over the virus. If you go into terms, it's an RNA virus. That's what it is. There are other forms of coronaviruses. You definitely have the human coronavirus. Sometimes you might have some family members coming up with the human form. Please don't be scared of them. It's been around us for ages. It causes common cold. Now, we have other types of coronaviruses in animals. What we have right now, that's SARS-CoV-2, is a zoonotic disease. It's coming originally from the bat. Humans do not have any immunity against it as of now. That is why it's spreading as fast as it's spreading. The virus is SARS-CoV-2-19, and the disease is COVID-19. Now, the incubation period is about 1 to 14 days. Some experts are now postulating it's about 5 days. In terms of symptoms, you can have mild symptoms and you can have severe symptoms. And I would say that these mild symptoms may go pertaining to your underlying medical problems. For mild symptoms, we know that we are going off fever, cough, and also shortness of breath, and this is common in a majority of patients. Some patients I've read about are also complaining of myalgias. In a few sets of patients, they would have sore throat. So it comes to the point where it becomes really clinical judgment on some providers if we have this in their community. For severe cases, they would have acute respiratory distress. They'll still have the fever, they will have the cough, and most of those patients will need medical attention. For patients with mild symptoms, most of them do not need to be in the hospital setting. What they need is hydration, they need some Tylenol to take down the temperature, and they just need to be at home self-isolating. If they are staying with other people, especially other people who have underlying medical problems, they should self-isolate themselves in that home to keep their family members safe. For severe cases, out of a trial coming out of China, 44,000 cases, overall mortality for that trial was 2.3%, as Melanie already said. For patients with no comorbidities, it was 0.9%, a walk through the park. For people with, who are older than 80 years, the mortality rate was about 15%, and that's really high. Cardiovascular disease, 10%, diabetes, 7.3%, chronic respiratory disease was 6.3%. So if you think about it, these are all people that we have in our community that we have to protect going forward. You cannot think of yourself. Think about your relative. Think about your grandfather, your great-grandfather, your grandmother. Think about all the people that you interact with on a daily basis. You protect yourself, you're also protecting them. Now, in terms of patients who have severe disease or have underlying medical problems, if you cannot breathe, you definitely have to call emergency services to come get you for the hospital. But if you just have mild symptoms, give us a phone call. Faith Regional Services currently has a virtual visit. And with a virtual visit, we can talk to you and also, in a way, try and see how good your symptoms are or if you need immediate medical attention. If you have a primary care provider, feel free to call your primary care provider. There are ways of working with this. And you don't really need to come to Faith Regional, emergency room, or urgent care. You can go to our off-site screening site if it's determined that you need to be tested. For prevention, I think the most important thing is that we need to protect ourselves. Standing right here, I was looking at everyone. Good things that we have to do. Hand hygiene, number 1. 2, please do not touch your face. It's the most difficult thing to do. I was just observing and checking, and I tell you, it's difficult. Even for me, it's so difficult not to touch my face. Hand washing as much as you can. Social distancing. So you wonder what social distancing means. Stand within 6 feet or 2 meters of someone, and if you cough, please cough into your elbow. Don't cough into the world. When you cough, what happens is that you have all these little droplets showering out, and it can land on someone. You don't want that. You want to keep your community safe. Melanie and Kelly already mentioned, and also our mayor mentioned, that we don't have this in Northeast Nebraska. I think as a community, we can keep it the same. We can keep COVID-19 from coming here. What can we do? If you don't need to travel, please don't travel. If you really need to travel, make sure you have a hand sanitizer on you. Don't go to places and touch services. When you touch services and somebody has COVID-19, you're probably just catching the virus. Don't touch services. If you are sick, stay home. And try as much as possible to think of your neighbor who has other comorbidities. You want to keep everyone safe. Thank you.
Thank you, Dr. Mensah. Next, Kathy Nordby, who is director of the Midtown Health Center.
Thank you. I'm going to keep my statements brief, but I'm here representing, as I feel, access to primary care, and we play an important role before you create saturation at the emergency room. And so we are open for business. As a federally qualified health center, we see as a responsibility to assure access to people with barriers to care. I would recommend, if you have health conditions that you're concerned about, you talk to your primary care provider. If you don't have a primary care provider or that provider is not accessible, you can call us for new appointments. We're taking new appointments. But like other primary care providers, all the doctors in town are recognizing that we have our ongoing healthcare needs while dealing with the COVID. And so we are really working in our facility, and I think others are as well, to separate ongoing need for care. We're still having babies. We are still having health issues, and those should be dealt with based on their urgency while working with this infectious disease. And we've done and accessed resources to have some of our people tested, but we've also discovered more influenza A than we've discovered COVID so far. So those other communicable diseases are out there, and luckily the treatment is the same. Wash your hands, stay home, all of those things. So we're fortunate that maybe some of the testing that we're demanding, if you're not acutely ill, experiencing a compromise, that you do just stay home and self-isolate, as I touch my face. But I wanted to communicate to you that we are taking action. We're still asking for call-in appointments. at 371-8000, that if you need an appointment, that we would triage you, because we're actually splitting our sites. We have 2 locations, and we're treating more of the communicable at 1 location, but it's really based on your need for care and your risk. And so that we're trying to keep clean sites for people that are dealing with other health issues. Or wellness issues, what a nice thought. So, and I think every provider in town is looking at those things, still trying to treat those patients. The elderly are being seen at special times. I think I saw it at a grocery store. Open the grocery stores from 8 to 10 for seniors to shop. Those are the ideas that we're incorporating in healthcare. And we continue to evolve and work with our partners. As a federally qualified health center, we do play that role between working with our hospital system, but a branch of public health, and we help deliver packages to nursing homes last Friday for the public health department. So that's kind of a repurposing of staff whose demand changes because we offer the oral health care and the behavioral health services. Also experiencing acute needs, but also if you are not in acute need, we can divert those resources to help other systems. So I thank you the opportunity to talk to you, but really primary care has a role, and seek them if you need advice. Thank you.
Thank you, Kathy. Next, for a report on our community schools, Dr. Jamie Jo Thompson, Superintendent of Norfolk Public Schools.
Thank you, Mayor. Following our community discussion last Friday, Norfolk's public and private schools made the difficult decision to close temporarily. We took many factors into consideration as we made that decision, including the information provided to us by our healthcare professionals, many who are here today. Also, the number of people being tested for COVID-19 within our community, and the need for us to plan for a potential long-term closure. Thankfully, children typically do not have a serious reaction to this virus. However, children can carry it home to their families and pass it along to others in the community who are more vulnerable. Therefore, school closures play a very important and necessary role in slowing the spread of this virus and flattening the curve. Because of this, the governor has indicated that a single case of community-spread COVID-19 in our region or ESU will result in a mandatory shutdown of schools for at least 6 to 8 weeks. Our current temporary closure will help us to be prepared for that possibility. Norfolk Public Schools is fortunate to have Chromebooks for all students in grades 5 through 12, which can be utilized for e-learning opportunities. However, we know that not all of our students have access to internet at home, which means that our teachers will be required to prepare 2 sets of lessons, an electronic lesson and a traditional print lesson that parents can pick up at schools. This will be a very time-consuming process for our teachers, but we are committed to ensuring that all of our students are provided with the opportunity to continue their learning during a shutdown, regardless of their internet access. We do not have devices available for our preschool and elementary children, so they will be provided with traditional print materials. In addition to continued learning opportunities, Norfolk Public Schools is in the process of making arrangements to provide grab-and-go food options for students so that they can continue to receive nutritional meal options throughout a possible closure. More information on these learning and food options will be shared as details become finalized. Norfolk Catholic also has one-to-one Chromebooks in grades 7 through 12. Their staff are meeting this week to plan how lessons will be delivered and how education in the least restrictive environment can continue. They will communicate updates with students and parents as their plans are finalized. Lutheran High Northeast will be delivering online instructions to students starting this Tuesday and will be closed until Friday, March 20th. It is important that students practice social distancing during school closures, which means that they should stay home in order to prevent the spread of the virus. Norfolk Public Schools is proud to be working collaboratively with our private schools, healthcare providers, city officials, and others to navigate these difficult times. We are committed to keeping our students, families, and our community safe and healthy, and I am confident that together we will meet that challenge. My colleagues and I intend to make a decision regarding whether our schools will be open next week before the end of this week. and we will communicate that to our parents and to our community as soon as we are able. Thank you.
Thank you, Dr. Thompson. Next, Dr. Leah Barrett, who is president of Northeast Community College.
Thank you, everyone. Northeast Community College chose to extend spring break to allow our faculty the time to adjust the format of their courses in the context of community mitigation strategies, such as asynchronous and online learning, social distancing, enhanced sanitization, and avoiding large groups. I met with faculty this morning. We continue to be open. We developed a website directly off our main page to provide answers to frequently asked questions and keep our college community informed. About a month ago, we instituted 2-stage cleaning procedures to reduce risk for all members of our college community and our guests. This procedure will continue. The residence halls and food service will remain open for our international students, students whose homes are out of state, or students that live far away. We also will allow students to live in the residence halls if that is the place where they can maintain their own health and safety. If a student is from the area, we ask them to continue to live at home, as we will work together to mitigate the spread of the coronavirus. If classes do resume next week, we will provide the academic program in a variety of formats, following the aforementioned community mitigation strategies. Finally, and most important, we've encouraged those individuals who are in our staff and faculty or in any risk categories to take leave if they are sick and to make arrangements to work from home. As others have said today, we join forces with our community partners, our healthcare professionals, and our educational leaders to do our best to help make our community safe for everyone. Thank you.
Thank you, Dr. Barrett. Next, for a report from our community partners, first, Randy Hagedorn, who is director of the Norfolk YMCA.
Thanks, Mayor. I'm like Kathy. I'm going to make this quick because my nose itches and I got to get out and get me itch my nose. So tough times, when you go in, but I found out with that meeting last Friday, like everything, we all work together well. The schools, the administrators, the board, unbelievable right decision on not allowing schools. So at the Y, that was a tough decision because they can't go to school. So they're supposed to come to the Y then. I mean, we're kind of defeating our purpose. And it's hard. It was a hard decision with our board and staff to do that because with our new addition, everybody's been so excited about it. We went from 8,000 members before we opened it to we're close to 11,000 members now. So we know we're a place for people to go. So it was a tough decision. We are scheduled right now to be closed until a week from Wednesday, which is the 25th, but that may change. We always close for a week in August to do a lot of cleaning, so we're kind of planning on doing that this week. And as a staff and a board, we've thrown some ideas around of some things that we can do, possibly, but no announcements are made on that. But we're trying to be positive with everything. And like I said, it's like Mayor Money said, we're all working together on this, and we need to continue that. So at this point, that is what we are looking at, and we'll keep everybody updated, and we'll continue to work with this group. So thank you.
Thank you, Andy. Next, from the Norfolk Area Chamber of Commerce, President Denise Wilkinson.
Good morning. At the Norfolk Area Chamber, we understand this is a difficult time for our communities and our businesses. Our local businesses need your support now more than ever. Our Northeast Nebraska business community is resilient. We have showed that in the past. Our businesses are looking at creative ways to continue to offer the services to conduct their businesses. Your decision to patronize our local businesses first will lessen the financial impact and the effect on the local workforce. The Norfolk Area Chamber will continue to be diligent in relaying local, state, and federal guidelines, as well as educating the public through creative ways the business will continue to offer services. Thank you.
Thank you, Denise. And to conclude, representing our public safety and regional emergency service operators, Shane Widener, who is Public Safety Director of the City of Norfolk.
Thank you, Mayor. Our public safety response will continue to be strong in the region. Our operators, our law enforcement officials, dispatchers, firefighters and paramedics are prepared and becoming more prepared every day. Through the efforts of emergency management and our public health partners, additional personal protective equipment has been deployed in the region and more to come. So I'm confident in that response. I'm more confident in the community and the response we're going to have as citizens of the region. And I can tell you, these operators, from the ER doctors to the nurses to all of our public safety people, are really the point of the spear. So I wanted to reiterate the importance of our community to consider their 911 response. Our dispatchers are triaging or sorting callers, if you will, as people engage in the system. And then our operators out in the field are continuing to do that. When they encounter a patient, there's a series of questions that they ask. Please be honest if you're in that situation. And please be upfront with fever history, shortness of breath, the obvious things, your travel history. All those things are important. I can tell you firsthand that our EMS providers have encountered patients out there that were triaged in that manner and weren't forthcoming until way towards the end of that interview, which completely changes the response for our medics and our law enforcement personnel and our dispatchers and our ER. We need to be that point of the spear, and we need to be able to communicate that effectively as it goes down the chain. Call 911 if you have a true emergency. If you have a cardiac event, a major respiratory emergency, a trauma, it's business as usual. Call 911. That's what we're there for. If you are feeling sick and you're just wondering about your symptoms, there's plenty of resources, and it's been mentioned here in spades. Use those resources in the community to try to help triage yourself. I could tell you that our emergency recalls have actually leveled and actually decreased somewhat over the last 10 days or so. I hope that is a good sign. I hope that's an indication that our citizens are, again, taking care of themselves and taking care of each other out there in their homes. So we'll continue that response, and we'll continue to be ready to make good medical and good law enforcement decisions. And that response, again, will be strong. It's going to continue to be strong. It is now, and it will continue in the future. So with our citizens' help, we'll definitely lick this thing. Thank you.
Thank you, Shane. We'd now be open to questions from the media or anyone else. Does that mean we covered it all? Okay. Well, this group will be here for several minutes afterward in case anyone has questions for us personally. But thank you again to all those tuning in. Again, we encourage you, if you feel unwell, stay home. Be smart, proactive, and vigilant about your health, not only for yourself, but for your neighbors. And we'll get through this. Thank you.